We're joined now by Annie Garcia. She's a Democrat running for U.S. Senate here in Texas. Ms. Garcia, welcome. Thanks for coming in.
Thank you so much for having me. It's a pleasure to be here.
Glad you're here. Tell us a little bit about yourself and why you decided to run for Senate.
Well, since I was a late filer in the campaign, I like to lay the groundwork a little bit. I grew up just down the road in Georgetown, Texas, where my mother, actually, Mary Ellen Kirsch, was the mayor for a couple of years in the early 2000s. I attended Rice University and then came back to Austin to get my law degree from UT Law. I am a lawyer, a small business owner, and I started a nonprofit organization. I currently live in Houston, but I've spent the better part of my life in Texas, and I like to say que también yo vivía por 2 años en Ecuador, unos 4 más en España, und ich hatte auch die Gelegenheit, 2 Jahre in Deutschland zu verbringen. Only thanks to a Texas public school education can I ask Texans for their votes in English, Spanish, and Deutsch.
Deutsch. Very good. You put quality health care for all at the top of your list of priorities for your campaign. How would your plan differ from the others who are running?
Well, so I have a very unique experience. In 2014, my daughter, who was 6 weeks old, just kind of flopped in my husband's arms. And I rushed her into the emergency room to learn at that point that she had an undiagnosed heart defect. And unbeknownst to us, for the first 6 weeks of her life, she had been slowly suffocating to death. As a result of this, she had suffered brain damage, and she was immediately admitted to the ICU. We did not have insurance. So for 12 weeks, she was in the ICU, and ultimately she underwent 2 open heart surgeries, dozens of medications, procedures, but she made it at a cost of $1.5 million. My baby lived. Now, this should have wiped us out financially, but she was lucky because she was born in Spain, and we didn't need insurance. And so all of the issues that come with having a medically fragile child did not happen to us. And because of that, I was able to start a nonprofit organization. So what I want is a model that looks like Spain. Universal health coverage, and I really resist the idea that it has to be, within the model of Medicare for all. We need to create a system where we don't have co-insurance, co-pays, out-of-network costs, all of the different ways in which people are essentially fleeced when they go into the hospital.
It's a huge issue.
So up to 400,000 people die every year in this country. 400,000. Third leading cause of death in our country is medical error. So somehow we have a system where we're paying out the nose for it, and yet at the same time, it's not very good. And our outcomes, if you look across the world, do not fare as well as the other single payer or universal healthcare system. So how we get to this point where we pay more money, 65% of people that declare bankruptcy do so because of medical expenses, and yet 25% of people are inadequately provided for within that system. It's beyond me.
Let's talk about restrictions on gun owners. You've proposed that, some new ones for reducing gun violence, of course. Tell us about your ideas.
So I think this comes from my experience having lived abroad. We in the United States are such an outlier, statistically speaking. We have roughly 40,000 deaths at the end of a barrel every single year in our country. In comparison, we have more deaths in a week in our country than most industrialized countries experience an entire year. And so we need to go beyond the talking points of background checks and close the gun show loopholes and red flag laws. We need to get creative and we need to get clever. So I want to see every gun owner required to carry gun liability insurance. We require it for our cars. This is what insurance companies do. They assess risk. So instead of externalizing the financial costs of this gun violence, let's start putting it back where it belongs, which is gun owners.
Some would say that is a divisive stance. How can you reach consensus on this gun issue?
I don't think I have to. Americans are there. This is a situation where government isn't doing the will of the people. We have people that 90% you have more discussion over Thanksgiving table over ham versus turkey. There's more divisiveness over that than 90% of people want background checks. People are there. We have sacrificed our right to life, liberty, and the pursuit of happiness for what? For what? So that people can go around and carry their guns. And as a result, we have we have this, we're in a situation where such an outlier internationally. There's nothing different from our country than those countries than the fact that we prioritize gun profits over people's lives.
Do you see a time when gun confiscation would be part of your plan?
I mean, I don't even talk about that. I don't think about that. What I want to focus on is the things that I think we need to start working towards, the things that work. I don't know if that would work. It's very problematic, and that really upsets people when you talk about that. Let's start with putting liability insurance in place. Let's close the gun show loopholes, and then let's work from there. But we have to address this issue. I went up in front of the Texas House of Representatives Committee on Mass Violence, and I asked them, are you okay with this? Are you okay with this? As a country, are we okay with this? Because either we need to acknowledge that we are and we say, you know what? We really do feel like it's more important that people have their guns, or we say that no, we're not okay with this and we have to figure this out.
Another divisive issue here in Texas, immigration policy. Many people agree it's a broken system right now. How would you approach it as far as solutions go?
So this is a very personal issue for me. As an attorney, I practice banking and finance law, but I also practice immigration law pro bono. And I've represented asylum seekers coming to our country that have fled the most horrific conditions you can imagine, all of whom I was able to get asylum in our country. In addition, my husband is a naturalized U.S. citizen. We have relatives in Cuba. I help with their papers. I have seen the system firsthand. As a wife and as a family member, and then also as an attorney, and I tell you, it's broken. It is broken. It does not work for at least 50% of the people that it should. So we need to look at it as, I believe, a two-prong approach. We need to look at the people that are currently in our country that are undocumented, and we need to figure out how to get them on a pathway to citizenship. And then we need to look at people that are trying to enter our country who want to come to our country and make sure that we are honoring our American values and our economic needs at the same time.
On the day this interview airs, you're going to be beginning a walk across Texas. Tell us about that. Why are you doing it?
I want people to see who I am, how I think, how hard I'm going to work for them. And instead of saying that I'm different, I want to show people that I'm different. So this was the one thing that I could come up with that is completely within my power, putting one foot in front of the other. And it's something that so many people do every year to come to our country. They walk thousands of miles. And so I thought, you know, if there's a will, there's a way, and I want people to see my heart. And so I'm walking 420 miles, 30 miles a day for 14 days, which is about, I think, the max that my husband can solo parent, or I feel good about asking him to solo parent. And I want to talk to people. And so I'm going to start out in Houston. We're going to have a kickoff. Little Joe from Little Joe y La Familia is going to join me. And then I'm going to make my way west. I'm going to go through the Rio Grande Valley. I'm actually going to be going across the border into Matamoros. I'll be coming back to the Austin area, Austin, San Antonio, Buda, New Braunfels, and then going over to Georgetown. And then walking between Midland, Odessa, and finally ending at the Walmart in El Paso where the mass shooting occurred in August.
Quite an adventure ahead for you.
Yes.
Stay safe out there.
Thank you.
Andy Garcia, Democratic candidate for U.S. Senate here in Texas. Thanks again.
Thank you.